Right. Good morning, everybody. I'm Laura Gage, Marketing and PR Manager at the North East Automotive Alliance. Thank you for joining us this morning on our second webinar with Recovery4Life, this time focusing on mental health in the workplace. So if you hear any little buzzes in the background, that's actually my children, so do forgive me. I think this presentation will be very, very relevant to me. But anyway, we're glad to be joined by Recovery4Life again. Thank you very much, John Devitt, who is the CEO. Recovery4Life are based in Townbridge, a highly specialist workplace testing, training and treatment service for drugs, alcohol and mental health. And in response to the pandemic, Recovery4Life is providing corporate clients with testing kits as part of risk management program. This enables businesses continuity in line with government guidance, and they're donating profits from the sale of their testing kits to support essential services for vulnerable people. And I believe that's now in the realm of £8,000 you've raised so far to date, which is absolutely fantastic. So anyway, without further ado, I'd like to hand over to John, who's going to give us an insight today in the impact of COVID-19 and how this is impacting on people's mental health in the workplace. And I think sort of 5 weeks in on lockdown, this is a very relevant subject. So over to you, John. Thank you.
That's lovely, Laura. Thank you. And once again, thank you to the NEAA for hosting us. And, you know, what I would say, first of all, thank you for everybody joining us. But I would make just point that the views that I'm going to, the presentation we're going to go through, there are views. They're views based on our own experience working in drugs, alcohol, mental health over many years. And really what we're talking about there is working with chaos. So we actually think it's directly relevant to the situation that we're currently going through globally with the current pandemic. But we also look a lot at recent research and current research and on similar sort of situations, though this is unprecedented. But also really around human behaviour, mental health and addiction, and how people cope under times of stress. So just if you could move on to the first slide, Laura, please. So the very first thing there's three main areas I wanted to cover today. And we always say when you're looking at mental health, you've got to start with yourself and your own situation. The second thing I want to cover, and I'm not going to talk too much around self-care, I'll touch on it, but there's some very good resources online if that's something you're interested in, or you need some sort of tips on how to look after yourself the best you can. So the main focus is around what we can do about the workplace, but we always say start with yourself. The second thing is we need to look at what the impact on your teams. And the impact is how it's impacting currently, but also around what to expect for what it's going to be like when we get back to whatever normal looks like at the end of this. And the third thing we really want to touch on, first of all, is to get people thinking a little bit around that we need to start planning for the return now in terms of what the mental health of our workmates, our colleagues and ourselves is really going to look like, and what we can start planning to do now to put in place the programs or some sort of support to start thinking about, you know, what's going to be needed when this really kicks in. So if we can start, first of all, move on to the next slide, Laura. Thank you. So I think this pretty much sums up where we are at the moment. We're living in unprecedented times. You know, there's a lot of misunderstanding around COVID-19. There's also a lot of misunderstanding around issues such as testing, access to treatment, what the side effects and symptoms are. I think the whole concept of social isolation, which ourselves and people like WHO are really trying to change the language around this to highlight the need for actually what we're really talking about is physical isolation and much greater social integration, to be honest, rather than isolation. But there's a real sense that actually we're in turmoil. And it's not just individually, we can't just look across the globe and say, well, it's just happening there. This is something that's happening everywhere. And as we were touching on a little bit earlier, it makes you realize actually first of all, the connectedness that that we all have within sort of, irrespective of what culture or country you're in, but also the impact that this will have on everyone. Everybody's affected by this. Now, if we start with the virus itself, basically it's something that attacks the lungs. It's a respiratory disease, etc., etc. The knowledge around it is changing every day, and we take advice from a consultant virologist, a special infection disease specialist. We've got our medical directors in primary care, etc. But the real thing we're seeing is what we know is how little we know about this disease and this virus. And although sort of the initial symptoms sort of were very straightforward, it might be sort of symptomatic of a flu, for example. What's really interesting is the fact that there are so many other symptoms coming out, such as, for example, diarrhea, which was ruled out immediately, as a sign of it not being COVID. We're now seeing cases like that. We don't know actually how many people really have it, how many people might be asymptomatic, how many people may be super spreaders and super shredders, as they're calling it. So with this sort of whole environment, what we've really got on is, what we've really come into is a whole climate of fear. So if we move on to the next slide, what we really have is a whole range of different areas where we're sort of flagging up to us. There's the initial fear of physical health, both for ourselves and our loved ones. There's the fears around money and how we're going to survive and will we have jobs at the end of it. The whole panic around food and toilet rolls when the lockdown first took place around the 23rd of March. And of course, the distancing from family and friends, who creating this sense of isolation, which is going to be very difficult to sort of deal with. Now, if we move on to the next slide, there's also this issue of isolation. There's 3-4 areas here which we need to pay attention to. And when I'm going through them, have a think how it affects yourselves and your families and people you know, your family and friends. Because actually there's a number of issues. First of all is loneliness. Not following the same routines that people are used to, not being in the workplace, not seeing colleagues, whatever you think of your job. Actually, the isolation and also quite often lack of space that people have is really sort of starting to cause problems for people. Pre-existing conditions are being exacerbated all the time. And particularly people who already might have conditions like myself with asthma, for example, are actually, it's heightening anxiety around these sort of existing conditions. And the real one is this separation from work, which I really want to focus on, because actually it becomes key for the reintegration around work when we actually, if we want to really address some of these issues. Nora, if you can move on, please. At the same time, physically, not just about underlying conditions, but diet, exercise, breathing, and sleeping. All of these issues are actually making us currently a lot more unhealthy. And if you look at all the work that's been done over the past few years around health and well-being, particularly in the workplace, programs such as Better Health at Work and various other things like that, which have campaigned to try and increase exercise levels, improve diet, reduce sugar intake, all these different, smoking, for example. A lot of this work, I wouldn't say it's actually out the window, but it's got to be revised in such a way to compensate for the current situation, basically. Next slide. Again, linked to this, relationships. Actually, there's a lot of rebuilding of relationships that have to take place with your own family and friends, for example, work colleagues, community groups. And it's what has been very strong, particularly in the UK, is the sense of community where people have sort of found a purpose trying to help people around them. The clapping for the NHS on the Thursday night isn't just about the NHS. It's a sense that we're all in this together, and that it gives a sense of purpose to us when at a very difficult time where we don't know what's happening. Next slide. Now, we started ourselves. If we're feeling like this, your team will feel the same. And if we move on to the next slide, what people do when they are under pressure and when they are in a state of heightened fear, that creates a number of different conditions. The very first is we can't act as we would normally do in terms of when we're feeling with a perceived threat, basically. The amygdala kicks in at the back of the brain, which sort of creates the 4 responses primarily. You have fight and flight, but you also have freeze and flop. And actually, when you can't fight something, because we don't know what we're fighting, where you can't flee because there's nowhere, you know, we're on a lockdown, you have to stay where you are. When you freeze, you're going to unfreeze before this is over. And flop, when you wake up, it's still going to be going on. So what then happens is that actually this heightens conditions such as a range of anxiety conditions, depression, we see a huge increase in PTSD, and we'll also see conditions such as OCD, insomnia, overeating, a whole range of different sort of responses where we sort of basically carry out behaviors to release dopamine to make ourselves feel better. And the main ones, if you think about it from the workplace perspective, and this is really where our background comes into play, is if you look at the impact around alcohol. We saw a recent study showed that from Alcohol Change UK about a week ago, in their recent study, 21% of people admitted that they were now drinking every day, and to different levels. Actually, in the very first few weeks of the lockdown, alcohol purchases jumped up by 28%, and that's without pubs being open. The impact on gambling, the gambling industry is making a lot of money at the moment. Drugs, people might not go out to sort of are careful about shopping, but the increase in, if you've got a drug deal and somebody selling cannabis, there's pretty much somebody on every estate or every street who is able to get drugs. Then actually we're seeing an increase, and we're seeing relapse in both drugs and alcohol amongst our clients currently, and lapses. Self-harm seems to be on the increase, as is with suicide and suicide attempts. We don't actually have any data on this because of the priorities are rightly on COVID at the moment. But the impact on this going forward really is unknown. We just know it's increasing. Next slide. So what do we do about it? That's all the negatives. And it's the key really for me and for, you know, the colleagues that and the clients we're working with, is the starting point is look at your existing resources. This is going to impact in a way we just really don't know yet. So the starting point is see what you actually have in place. The advice we always give is have a look at, if you haven't done so already, check if you have an EAP program, use your existing EAP, but check with them that they're actually open. Some of them aren't. And some of them have staff who've been furloughed. Some of them have staff who are struggling themselves. And just check that the nature of the EAP that you're signed up to actually meets your needs and is able to cope with issues such as drugs and alcohol. Not all are. And see if they're able to deal with suicidal sort of responses as well. I saw a very interesting webinar from the City of London group. I actually made a very interesting point because groups, excellent programs such as those run by Mind, for example, and the Samaritans, are completely overwhelmed at the moment. And one of the interesting calls that the City of London Mental Health Group called for was that actually, if as a company you can afford an EAP, please use it to help take pressure off public services. And it's interesting that there are some people who are covered by an EAP program who actually have forgotten about it and are putting additional pressures on those public services and those on the charity sector. If you have mental health programs in place, this is the time to start thinking, is it going to be fit for purpose? Mental health first aid will be a useful starting point, for example, if you have those programs in your company. But actually, this is the time you really need to look at upskilling, supervision and support in different areas for those people who may become a focus within your organizations for people to come to. So it's going to be a different sort of type of program and the different pressures that they may have to respond to. Likewise, one of the key things we've seen for good mental health is having sense of purpose. Where you have volunteering programs, where you have CSR programs, even if staff are furloughed, try and engage them now. Start talking about how you can get a team together to help out locally. The sense of purpose is one of the greatest ways you can actually get a team focused on addressing and avoiding the sort of pitfalls we've just been talking about. Next slide. Next slide, please, Laura. Now, one of the biggest issues and the real pressure that people are having is understanding where testing fits in. And one of the issues on this, and we get this question pretty much every day, and it's directly related to mental health, and it's this sense of physical and psychological security that people have and are worrying about for the return to work. And currently, the UK is not doing very well on this. We currently rank 16 out of 19 countries for testing where there is data available. The most effective programs we've seen or come across are in places like New Zealand and Singapore. South Korea's actually done quite well, etc. But actually, you can see, and we'll just leave these up here, there is a lot of, there's a clear link between testing and how effective a program is, a country responds to the pandemic. Now, in this context, we're not talking just about the physical security. We're talking about psychological safety. And what struck us is a number of the clients that we're working with who've adopted the sort of testing programs that we've helped them develop. Actually, the main comment that's come back to them is that it's changing the psychological contract between them as employer and with staff. So it's an interesting point, and it's something that we hadn't quite thought of when we first set out when we were designing these programs. Next slide, please. So where should our priorities really be when we're starting looking for the return? The very first thing, and this is where it's important to start, and if you're not already doing so, you need to start re-engaging with your workforce. The priorities we would suggest is people who immediately have become victims of COVID-19. The death rates in the UK are quite, unfortunately, they've sort of seemed to have peaked over the 40,000 mark, which is twice the level that I think it was Mr. Johnson described as a good result would be if it was 20,000 or under. But we're twice that level now. And what this means that where you've got issues not just about directly with COVID, but underlying health conditions, people not going to hospital for routine checks, not going to hospital for cancer treatment, not going to hospital for heart conditions, etc. The long-term effects of this is going to be quite stark. So it's really important to start engaging with teams and seeing where both for themselves and their family members, what this impact could likely be. The people with existing mental health conditions that you're aware of, we would suggest you also need to focus some resource or some, start contacting them, checking they're okay, making sure they're linked in with existing programs or with public or third sector providers if you don't have an EAP. Also be aware around care responsibilities, not just for those with children, etc., but with people who have elderly parents, either living with them or in care homes. And I think one of the features that's come through in a lot of the sessions we've been running for individuals has been the fear around no resuscitation policies and issues like that, which obviously is going to affect many, many people. The impact on furloughed staff, if they feel that actually they're not connected to the workplace, is something that we definitely need to look at now, because the communication, volunteering, trying to build a sense of that and maintaining the sense of a team is going to be crucial for that return. And the big issue that we're seeing is that the research around PTSD, for example, for when people return is it's low at the moment, because PTSD usually emerges a few months after the end of a situation. But if you go back to the 2016 SARS experience, some of the research that came out from that was twofold. First of all, that actually people with children who they were self-isolating with actually suffered higher levels of PTSD, particularly women, on the return to work. The other issue was that other research showed that anywhere between, I think it was 28%, depending on the study, and up to 40% of returning workers had some, pardon me, some experience or traits of PTSD on the return to work. And this has immediate issues where you're dealing with insomnia, where you've got increased drinking, etc., etc., on issues such as health and safety in the workplace, and how safe people are going to be actually working, particularly in safety and safety critical and safety related roles. Next slide, please. And that pretty much sums it up on what we're actually looking at. We really don't know what things are going to look like. We don't know how people are going to respond. We don't know yet what the death rate is. And we don't know how many waves of COVID-19 there are going to be. There's certainly going to be a second one. All predictions are that it's going to be a lot worse than the current one. And it's about how do we build that sense of solidarity and resilience into teams and with teams to come out the other side. Next slide, please. So what we would do, a few short messages. The very first thing to do is really think about what culture you want in your organization, because this is the time to change it if you're not happy with it. We definitely will be needing to look at a more caring and accommodating culture. We really need to start looking at the relationship and the contracts psychologically, physically, and also financially that we want to have with the people who work with us, and the programs, particularly health and well-being programs, that people want to offer or need to offer for that return to work. Next slide, please. Communicate now, don't wait. This is a time for leadership. It's time for planning, engaging, looking at training plans, getting that shared vision, but also really looking at actually what a post-lockdown health and well-being strategy will mean for you. Next slide. And prepare. The issues, every plan for, if you haven't already got one in place, and we will be pulling together a giveaway where, if you watch this space, where we'll put some ideas together now of what we're seeing people doing that seems to work both internationally and here, to actually look at addressing issues such as physical safety. How are you going to do deep cleans? How are you going to communicate that to your staff? Can you actually, is testing appropriate, for example, particularly for physical safety? And I'll come back to that in a minute. Psychological security is absolutely key here. It's that sense that people, and recognition that people know that when they return, that it's not like going back to school at the end of the summer holidays. This is actually going to be sort of coming out from the caves and looking in the light, and things will look very bright. Hopefully, but actually we've got to prepare for the worst if the sort of the trail from what we're experiencing now follows us through. We also have to prepare for loss. People will and have lost people, and grief management is going to be something that will form how we shape those new psychological contracts that we touched on already. Next slide, please. And also, one of the things that, again, I mentioned testing earlier about psychological security and well-being. It was an interesting comment, which I won't go through, but we put it here from Sir Jeremy Farrar from the Wellcome Trust. And where we have used testing, actually, it's not been so much really around the spreading of a virus. It's actually been about saying to people, this is a tool, it's one way that we can actually support you in the workplace and reassure you that if you do come into work, other people around you aren't necessarily going to infect you and you're going to bring it home to your family. And that's one of the big issues that people has come out in the discussions we've had with clients around mental health in particular. Next slide, please. Before we move on to some questions, I just want to, and if you could please fire some into Laura there, and we'll just move on to the next slide, because I just want to leave on in summary. The environment's changing rapidly. The understanding of COVID is changing rapidly. It's very likely that the return to work is going to coincide with the crossover very shortly with a second wave of COVID hitting. Now, it's that period which is going to be crucial, where people are trying to reconnect and reestablish themselves in the workplace, but the fears around the next stage will be coming to light. And that's going to be a crucial time for every company as it reestablishes itself. In real terms, we're looking at least 12 to 18 months going forward of a similar situation. The senior chief scientific advisor yesterday quite rightly admitted, actually, even if the tests of the vaccine come through, you're looking at least a year realistically before there'll be something that could be issued for mass vaccinations. And what that really means is we need to look at new ways of working and living. We need to look at how we can protect ourselves, our families, and our colleagues from both physically but also psychologically. And it would be very interesting to see or find out from different companies. Please engage with us and share what you're planning to do for that return. So we'd be happy to take any questions now, and thank you for listening. See this as the beginning of a conversation, not the end of it, and please feel free. We don't like to leave anybody left sort of in the lurch. So if any of the issues we've touched on this morning has directly affected you, or if you would like any help, or if you don't have any provision in place already, please get in touch. We offer EAP programs and more of the specialist support particularly for drugs, alcohol, and mental health. And we'd be very happy to help you at this time. Thank you.
Thank you, John. That was very interesting. If anybody's got any questions, you can send them through the chat facility, or just simply unmute yourselves and ask away.
I've got a question for you, John. It's Stuart.
Hey, Stuart.
Hi. So if you've never really looked at your mental health before, right? Yeah. A lot of people don't. How do you start to understand it?
Okay, so we operate in three ways, okay? Start, quite often, mental health or deterioration of mental health. Everybody has mental health, good and bad. So if you think of it this way, let's start with a positive. When you've had a really good experience, when you're happy, you will feel physically better, yeah? You laugh, you get a rush of dopamine, endorphins, all these nice things, for example. The flip side of this is actually the very first signs quite often of deteriorating mental health is when you start feeling ill. So there's the physical side is often the real giveaway when things start changing. If you notice that you are feeling more pain, for example, and a really interesting thing, the Northeast has the highest level of codeine use anywhere in, certainly in the UK, and I think And we've talked about this before.
Yeah.
But what's interesting is there is now a shortage of codeine and cocodamol and codeine-based products on shelves, which means one of two things. Either people are feeling more pain and are using more, which we believe, or they are stockpiling, which is less likely at this time. Okay. Now, pain is the first manifestation, if you can feel it. Actually, your immune system running down, getting colds, and sort of not being able to sleep, noticing that your fitness, your sluggishness is a big issue. And then you go into behavioral issues where actually what you want to eat is sort of sort of overeat, first of all, or not eat at all. But eating, you're drawn more to sort of fatty, sort of starchy, comforting type foods. And the biggest one of all is of alcohol increase. So we always suggest you work on 3 levels. The very first thing you do is you look at and see what the physical impact is. Because quite often with anxiety, for example, we almost entirely treat anxiety now as a physical illness. And what we do for that is you would treat that not necessarily with anxiolytics medication, but actually one of the biggest things is with no other support whatsoever, exercise will reduce anxiety and depression by around 30%. All the research shows, with nothing else. Yeah. So start with how the physical is, and then start seeing actually, well, how's this affecting you in other ways? Does that make sense?
It totally makes sense. John, I've got one more question for you, then I'll shut up. You know, you talk about culture. Now, you get a lot of support for people on the front line in terms of manufacturing, and we do loads and loads of courses. But do you get a lot of resistance from like CEOs and top management to actually recognise the importance of what you talk about?
It mixed, and quite often we work multi-sector, and there is a difference. But to be honest, it's not just down to sector. What I notice is there is quite often, it's quite often the best programs are the people who aren't spending a huge amount of money on sort of fruit on a Friday, etc., etc. But what they have is a very deep care for their team. Yeah. And actually, I think the key driver here is whether people, and this is what I was saying about culture, is this is really going to expose the companies, frankly, who there's a lot of lip service to. And without sort of pointing fingers or anything like that, it's very easy. We have a whole separate presentation called More Than Fruit on a Friday, for example.
That might be something we can do.
Yeah, well, and it's about practical things, because this is actually what people are going to be more interested in and feel secure, particularly about this psychological and physical contract about returning to work. That is the key, actually, for culture. That's what culture looks like. And it's the real thing is, do you actually feel valued and supported? Or is it just that actually, if you stay late, they'll pay for a taxi home for you? And that's they're very, very different things. This is a really good time to start reevaluating really what your company's culture is.
I've got one more question, sorry.
Yeah, cool.
Have you got a good example of somebody who does that?
Of somebody who looks after their staff?
An organisation that, doesn't just do fruit on a Friday, and you would say, well, that's a good organisation.
We do actually. We've got a few of them, but I don't actually have permission to mention them.
That's okay.
And I'll tell you why. This is an interesting one. I think and it's a manufacturer have actually. It was the level family business. I'll give you the outline of it because it's still really marked. One of the first people we worked with, and I thought these guys were amazing. Small family business going back to about 1840 or something, right? And in the family, small manufacturer. One of their team members who'd been with them in his late 20s, one of the team members who'd been with them since he left school, so 16, 17, he came unstuck with various issues at home and various other things, ended up starting using heroin. Actually got picked up. Most companies, you'd be out the door, etc. We were brought in because they said, what can we do to help this Okay, you would never see, if you looked at the environment, it was a very old-fashioned sort of workshop type thing. But it wasn't just about a sort of a familial atmosphere within the company. It was also the response to this guy from his colleagues, because culture isn't just set from below. Leadership comes from above, but a culture is about how people live and breathe and work together. And the absolute joy when we helped him, we came in, we got this guy off heroin. We actually managed to keep his family together. His wife had come unstuck with it as well. We managed to keep her in the job, 2 jobs kept, family kept together, both of them off heroin, back in the workplace, fine and dandy. But the real impact was not just on the people who ran the company, it was the team members, the people worked with him, they were so pleased for him. And not just that, the number of people who were saying, what can we do to support to help him maintain his recovery? Now that is a culture you can't buy that.
No, it's brilliant.
There was no Mickey Tate, there was no sort of condemnation. And that to me is a culture and they're a really good little company. They're great. I really like them. Yeah. But I don't have permission. I've got other really good companies as well, who are doing, one of the main companies who are doing, we do their drug and alcohol testing. We've been helping with mental health work, and also we brought in they're an essential service. And we brought in a testing program for them. Now, what they've done is actually, again, recognizing this contract, culturally, they opened it up to family members. And one of the things that we would do is part of our role is to sort of break the bad news, so to speak, 24/7 on if somebody got a positive for COVID. Yeah. And some of the results, when we were putting them through, they were there was one in particular, a 13-year-old girl who the company tested on behalf of the dad worked for the company. The level of appreciation, support, people actually said to us up front, said, we never thought they'd do this for us. And that is the biggest sign of culture than anything else, than sort of, can you see where I'm coming from on this? It's about
John, you've explained that really well. Appreciate it. Yeah.
It's about
really
investment.
Yeah, really do. Yeah.
Yeah.
Thank you.
No problem. Any other questions? No?
No more? Well, if anybody has anything that comes to mind afterwards, I'm sure John would be happy to help if he can.
Yeah.
And obviously, if you're okay to share the slides, we can share the slides afterwards as well. We've recorded today's session, so obviously if anybody once it's available, if anybody wants to share it around their workplace with colleagues, I think it's been really useful for me, so I'm sure it has been for other people.
Yeah.
Well, thank you. And likewise, the offer is we will be producing a giveaway just to sort of some top tips to sort of start for a post-lockdown health and wellbeing strategy, basically. So that'll come out in a week or so. But please, in the meantime, if anybody needs any help with an EAP or just bounce something off us, please feel free. Thank you.
Thanks very much, John. Much appreciated.
Thank you.
All right. Thanks now. Bye-bye.
Thank you. Bye-bye.